Thank you very much, Kim. I'm going to take a quick leaf out of Kim's book. From a parental lineage point of view, my name is Akosua Apia. I was born on Sunday, so thank you. My name is Tipo Mtabe, as Kim has said, and known as Akosua Apia in Ghana. I represent a collective of companies called the GBC Health. We're a global coalition of 200 plus companies, including a number of foundations and NGOs. We've recently formed an alliance with the Millennium Development Goal Alliance, MDG Alliance, and through this partnership, we engaged to be able to host a consultative and I think it was quite an innovative session on Tuesday evening. And this was made possible through a very, very good support base through the ALMA Foundation. And also, we also had a great partnership from Gates and the Gates Foundation. But I must say, we were set to only consult for 2 hours. And we were there for almost 4. So with that background, I'd like to just give you a sense of, we set out to clearly define 2 objectives. And the objectives were first to discuss and identify specific opportunities, what and where, and really looking at how to accelerate newborn survival, where the private sector can really add value. And adding value is really around looking at creating shared value, where businesses look at doing best practice, but are able to get full value out of that. The critical focus was on critical issues that would shape supply and demand to deliver sustainable solutions in key countries and working collectively in partnerships. You're going to note that I'm going to keep on stressing on collective, because collective action for the private sector is where we're going to see the critical action. The second part of our exercise in terms of our objectives was to look at kicking off the how. And the process that we looked at is how best to contribute towards the development of the NAP and its implementation with all other partners. A very, very specific objective was looked at, to develop a demand-focused and supply-focused PPP for launch by November 17th. That's very ambitious for the private sector. Very, very ambitious. But I think that what was amazing was the key commitment that we had. In the room, I'd like to name the companies that we had. We had McCann, DMI, GSK, Aspen, UPI, who were also representing the Clicks Group, BD, GE, Ladal, and of course, as I mentioned, the foundations, ALMA, the Gates Foundation, and CIFF. Now, with those companies in the room, on the what, we were able to, and I'm just going to give highlights on the key points that we were able to focus on. We really focused on key commodities and key services and the countries that would really be interested in PPPs to improve access. I think the presentations that we got were just phenomenal, because we actually made sure that we got presentations of successful PPPs. Because half the time when you talk about nice to haves and this great big creation of a PPP that no one really knows whether it's going to work and whether it's going to be sustainable. But we used the time and we allowed for presentations for very successful PPPs. And I think what came out of it is we then identified that we needed to include a lot more industries. So our consultation will continue, but we're going to make sure that we're going to include industries such as logistics and distribution, ICT, mobile, media, and the financial industries, to mention a few. We discussed health systems challenges in newborn health that can be overcome from an ICT and a mobile technology point of view, the challenges in creating demand for newborn health services, training and supervision of healthcare workers, especially in remote areas. I think the one thing that we made sure was, everybody in the room, and like I said, was 4 hours. So everybody made sure that they unpacked all the critical challenges and bottlenecks. And in this, we identified the access to referrals and reminders to patients to keep appointments, birth and death registration, supply and stock management. I think in having said that, you have a general idea that it wasn't just the what and the way. It was really about how. And that was the most important discussion. In actual fact, I felt like a teacher, because on the how, they had to break up into 2 groups. And I had to moderate this process, and I literally had to almost drag people back into the room. But it was good. It was a really good first engagement. And what came out of that was an agreement to establish a PPP group. And this is not just another group. And I'm going to take a leaf out of Lily. I can't see where Lily's sitting. But Lily had said to us, what would make this meeting different? And I think this is where the answer was. We created a PPP group that is going to be the integral part from an advisory point of view to have a vehicle to continue these discussions, to ensure that we're able to work with key partners within the existing working groups. It's not creating anything, it's just making sure that we have synergistic ways of working, building on existing initiatives and partnerships, and maximizing on opportunities of upcoming business events. So the JP Morgan conference that will be in April in New York, our GBC Health conference that will be hosted in New York in May, and we also have one which would be the Africa Regional Conference in October. And we will also be working with others as, the MDG Health Alliance, the UN Foundation, PMNCH, and other partners. But in closing, I need to stress the following. The joint efforts are going to focus on shared value and collective action. And that needs to translate into collective impact. Thank you very much.